I think that in terms of the quality of care and the consistency of care remains quite variable throughout the United States. I think that there are communities and areas that have focused heavily on this and invested resources in it and committed to following, for example, the American College of Surgeons Committee on Trauma guidelines and submitted themselves to site surveys by the Committee on Trauma. I think that the quality of care at those centers has been shown to be much better than the quality of care at other locations that have decided not to commit to that or commit the resources necessary for that. So it depends on the area of the United States, and obviously I'm not going to talk about what areas those are, but it does, and it is unfortunately still not consistent. I think that for brain injury in particular, more than any hypothermia treatment or any specific treatment per se, the key is consistent high-level care that is based on the best available studies and the best available guidance. And we have a pretty good idea of what that care is right now. A number of groups, most especially the Brain Trauma Foundation several years ago, have spent a great deal of time and effort to sort out what is the optimal care for a brain injured patient and what's not so optimal of care. They start with an inpatient program with physiatrists or physical medicine and rehabilitation specialists coordinating the rehab, who are trained in head injury rehab, know what they're doing. Those who are skilled and those who are dedicated, and it's an inpatient program at least for 3, 4, 5 months ideally, and then aggressive outpatient therapy with frequent outpatient visits and just, you know, a devoted team. But it's expensive. It costs money, and unfortunately, most insurance plans don't cover that sort of extensive rehab. Typically, what you see is that they will expect, if not weekly, certainly monthly, measurable changes, and often changes according to the Ranchos Los Amigos scale. Well, the Ranchos Los Amigos scale of functionality is a very, very crude scale, and it's only an 8-point scale. So, and you know, to improve one number on that scale can mean a massive improvement that's completely unrealistic over the course of a week or a month. But as you can imagine, insurance companies will want to glom onto that and say, well, you know, we expect that much change, or we won't pay for it.